this is my continuing coverage of the health care bill. We are now on page number 73, and it says, limitation on participation. No representative of any federal, state, or local government or any political subdivision or instrumentality thereof, and no representative of a person described in subsection C2A may serve on the board of directors of a qualified nonprofit health insurance issuer or with a private purchasing council established under subsection D. Now, what that means is that the President of the United States cannot serve on the co-op board. It also means that the governor of your state cannot participate on the co-op board, nor can your city's mayor be on the co-op board. Okay? So, there you go. Limitations of the secretary. This limits what the secretary can do with these co-ops. In general, the Secretary shall not participate in any negotiations between one or more qualified nonprofit health insurance issuers or a private purchasing council established under subsection D, and any healthcare facilities or providers, including any drug manufacturer, pharmacy, or hospital. Okay, so the Secretary of Health and Human Services can't walk into a meeting between the health insurance issuer and say they're negotiating with a pharmacy. Okay, so you got a health insurance issuer, they're negotiating with a pharmacy, and the secretary cannot participate in those discussions. Same thing goes for hospitals or anybody that manufactures medical equipment. The secretary cannot establish or maintain a price structure for reimbursement of any health benefits covered by such insurers. In other words, when your premiums come up, the secretary had nothing to do with what you're paying in premiums. And he also had nothing to do with what the co-op decides to pay to the health care providers. He also has nothing to do with what reimbursement you get from the health care. You know, you got this health insurance, and they give you reimbursement for your medical expenses because you've paid into your premiums. Well, that money was not established by the Secretary of Health and Human Services. Competition. Nothing in this section shall be construed as authorizing the Secretary to interfere with the competitive nature of providing health benefits through qualified nonprofit health insurance issuers. So, if we've got two not-for-profit health insurance plans, then if they're trying to compete with each other, the Secretary can't intervene with their competition. Wow. Appropriations. They are hereby appropriated out of any funds in the Treasury not otherwise appropriated. Well, it's $6 billion to carry out this section. So, the Secretary is authorized to spend $6 billion to establish these non-for-profit co-ops. That's a lot of money. Tax exemption for qualified non-profit health insurance issuer. In general, Section 501C of the Internal Revenue Code of 1986, relating to a list of exempt organizations, is amended by adding at the end of the following: co-op health insurance issuers. So if a not-for-profit health insurance issuer is finally established, then they are tax exempt. They can't be charged federal taxes. In general, qualified non-profit health insurance issuer within the meaning of Section 1322 of the Patient Protection and Affordable Care Act, which has received a loan or grant under the co-op program under such section, but only with respect to periods for which the issuer is in compliance with the requirements of such section and any agreement with respect to loan or grant. So in other words, if you're a health insurance issuer is a non-for-profit co-op, then the federal government can't tax them for anything. Isn't that nice? Conditions for exemption. Subparagraph A shall apply to an organization only if the organization has given notice to the Secretary in such a manner as the Secretary may by regulations prescribe that it is applying for recognition of its status under the paragraph. So they had to properly notify the Secretary that they're going to establish this co-op health insurance, except as provided in Section 1322C4 of the Patient Protection and Affordable Care Act. No part of the net earnings of which inures to the benefit of any private shareholder or individual. So in other words, these shareholders of the co-ops are not going to make it rich off this co-op. No substantial part of the activities of which is carrying on propaganda or otherwise attempting to influence legislation. So these co-ops can't influence what is voted on in Congress. Okay. The organization does not participate in or intervene in, including publishing or distributing of statements, any political campaign on behalf or in opposition to any candidate or public office. In other words, this co-op can't sponsor, say, like in the last elections, they couldn't have sponsored Barack Obama. Okay, and how about a few elections ago when we had George Bush? They couldn't have sponsored George Bush for an election. Okay, I think you get the meaning there. So, anyway, we are now at the end of page number 73. We're going to proceed on to page number 74 in my next video. I will tell you more in a future video, so stay tuned.